are non-convulsive, where patients don't necessarily jerk. Seizures also can be looked at as based on which part of the brain the seizure activity is coming from. Is it from a focus in the brain, just a small part of the brain on one side, or is this abnormal electrical discharge, this surge of current that I've alluded to, are they coming from both sides or everywhere in the brain? In that case, you say there's generalized epilepsy.
Okay.
So on that basis, you can have a classification on one side, looking at convulsive and non-convulsive seizure, or focal
epilepsy,
and generalized epilepsy.
Okay. Now that you have said there are some that are non-convulsive, how does somebody who is related to or living with such a person know if it's not the convulsive type? How do they know the person is having a seizure?
Okay. Like I said, we have convulsive and non-convulsive seizures. Let me give you an instance. In young people, maybe between 5 to 10 years of age, there's a kind of seizures that they can have that we call absence seizure, for instance.
The blank out.
The blank out. So you're talking to someone, and then suddenly the person is not responsive, but the person has not fallen, it's not falling down, it's not responsive. Sometimes it can be lip smacking, or sometimes can be blinking their eyes like this. But at that period, the person is not aware, is not communicating with you. Even when you're saying, please talk, within a few seconds, and then the person comes back. Now, some of these, the teachers usually write in their report card, is always absent-minded, not knowing that this child has some seizures. 2, some other seizures can occur where people drop things from their hands. So maybe when they wake up in the morning before going to work, you just hold your teacup or maybe a plate or your biro, you just see things just check off your hand. That can be myoclonic epilepsy. Sometimes people have seizures in their sleep, and then nobody recognizes it. But when they wake up, they could have some telltale signs. For instance, they could have bitten their tongue in their sleep.
Okay.
And then when they have that regularly, it's a cause for worry. Sometimes people can have abnormal cessation in activity, what they're doing, and then they begin to play with their clothes. They begin to fiddle with their clothes. Sometimes
so
if they're writing,
these are all telltale signs?
These are all telltale signs. And sometimes when you ask them after the event, what happened? Why were you not responding now? And then they don't have a recollection of what happened. So this might just be potential flags to say that, wow, this could be a seizure.
Does that mean that it could pose danger to the person since they're like not able to, they're absent as it were for a few seconds? Can it pose a danger to the person?
Of course it can. Of course it can. So just imagine that somebody is about to cross the road and suddenly develops one of these non-convulsive seizures, and it's just there. Cross the road, is not crossing. So things can happen. So yes. So what is important is for the people around to recognize that this person is having a seizure or there's an abnormal behavior going on. And so what you should do, what bystanders could do, is to help them gently take them away from where they are to a safe place without agitating them. Just, oh, sorry, just move a little, let's go. Put them in a safe place, and that's...
And one can actually do that while a seizure is going on?
Of course you can. You can. If the person is standing and having abnormal behavior in terms of lickman, you can lead them out of danger and raise them. So the seizures usually last for a few minutes, a few seconds to a few minutes, usually less than 3 minutes, and then spontaneously abort. Okay, most seizures will usually spontaneously abort within 3 minutes or less. But sometimes some seizures go beyond that time. And then when the seizure goes beyond 5 minutes, sometimes we begin to see that this person has a severe kind of seizure known as status epilepticus.
Okay, if somebody has a series of this kind of seizures unattended to, can it cause any permanent damage?
Thank you. So seizures, as I said, are usually less than, they usually self-abort within 3 minutes or less than. And then if a seizure has gone beyond 5 minutes, usually we say that this person is in status epilepticus. Or if somebody has repeated uncontrolled seizures.
At different times?
No. So if person has one seizure now, another seizure,
okay,
without recovery of consciousness in between these seizure events, we can say the person has status epilepticus. Status epilepticus is not pleasant to the brain because it damages the brain.
okay.
So people can have permanent neurologic sequelae from a status epilepticus. So you just want to get the patient to the hospital as fast as possible so that the seizures can be aborted. Because the more a patient has seizures, the more tendency that the brain can be permanently damaged.
I have heard of interventions whereby they operate on the brain and remove some sections of the brain to stop seizures. Is this applicable in epilepsy?
Okay. The treatment for epilepsy are of twofold. So there's a medical treatment and there's a surgical treatment. A large chunk of patients with epilepsy will usually respond to treatment, to medical treatment. Treatment with drugs we call anti-epileptic agents. But a few percentage, maybe about 5 to 10% of patients with epilepsy might not respond. So they may be refractory to treatment. So these patients, some get a surgery where a part of the brain could be removed. And most recently, there are implants. The neurosurgeon puts an implant into the brain to regulate the electrical activity and prevent the surge, the electrical surge that causes the seizure. So they can be implant, they can be surgery, and then most importantly, medical treatment.
Okay, I was going to ask about that implant thing because I felt that, look, we have electrical surgeries. People handle them, I mean, in mechanical things. So why not in the brain? But we'll talk more about that when we come back from the break. Stay with us. We're going on a really short break. We'll be back in a minute.